global limelight because of our quality and outcome, well published in various areas including Harvard Business School and Harvard reviews. So our goal and vision has been to bring such kind of high quality of care, and technology today is part of the quality care. Optimizing technology becomes very important when you look at how do you achieve quality of care in cancer, no side effects, better outcomes, where there's a collaborative effort for them to develop this as a center, not only for training, people from all over the world will come to train here in future, and also they are looking at having the research R&D department and investing in Karnataka with them in the future over phases where we can develop joint products including software products. Today, a lot of the work in oncology in the units like tomotherapy is also software, and as you know, Bangalore is IT capital of the world. So these are the things we are looking at in a collaborative way. So the most important thing for me as a clinician is that we are able to bring this and deliver this to our patients at an affordable cost. The cost actually is not much different from what treatments like IMRT, IGRT we are already delivering. The most important thing is the cost. Actually, patient doesn't have to go multiple tests, multiple type of programs in doing the day-to-day calibration as well as planning. This is an integrated machine which actually plans automatically every day, online boarding. You will see that we have created a model where we don't refuse treatment to anyone. We have a way of absorbing even the lower socioeconomic group, and that is what we are proud of. We feel that's a social obligation, and even though we do it as part of moral and social obligation, even though we have not taken any funds from government this regard so far. So with this, I would like to sum up saying that that today is a proud moment for us and for cancer care in India, because such high technology has been brought in by us, and we are able to deliver this kind of quality of care with the trained doctors and physician large group we have. In India today, we have over 400 oncology and oncology related doctors. As Dinesh said, we will be soon having from 20 centers to 27 centers, seeing nearly 40,000 patients going up to 80,000, globally largest cancer care, and very well recognized for quality and outcome. This is a part of that, our ever-growing endeavor to bring this kind of technology as well as research and future development in oncology care for our Indian population. Thank you very much.
A top-notch SBRT SRS dedicated radio-oncology machine. So I was introduced, I don't think I need to talk more about that. And I would like to really tell you who we are. A few other players. We have positioned our two products as a high-end product and the fastest growing segment of the industry. Our differentiation is really about precision. Both machines that you have seen are highly precise, and we have developed our entire position, our own positioning as a precision company.
And this tomotherapy doesn't not only acts on the visible disease, but on the surrounding cancer cells which are invisible. For both are complementary to each other. They are not exclusive. They are complementary to each other, and we are in a very good position now at HCG of improving the patient's cure rate, along with simultaneously reducing the possibility of side effects dramatically. So this has been the greatest development that I have seen, and I am sort of proud to be in a place where I have this flexibility of treating my patients without side effects and minimizing them. And our now primary objective as radiation oncologists is what I call from the couch to the office. Most of the patients will be on treatment and they will go to the office immediately. So that has been the development of radiation oncology, and this tomotherapy and Cyberknife have optimized made our job easy.
It's the first time I'm seeing a lot of advanced equipment under one roof, and I think that's the nicest part of working in in my hospital, and I really enjoy it. Tomotherapy, like we've all been telling, is one of the nicest way of delivering radiotherapy to the patient, because at the end of the day, you don't only want to cure the cancer, but also you want to keep their quality of life after cancer. And also, we only achieve this by minimizing the side effects. So initially, we were using large fields. So as and when the technology and the technique of radiotherapy evolved, less and less tissues were treated. But then we all felt there was a need to see where we're treating on an everyday basis. So that's why we have both CT and the linear accelerator married together in tomotherapy, where you can also see where exactly you're treating and what exactly you're treating every single day. I think this is a very good opportunity to have this technology available locally for our patients, and Dr. Ajay already commented, this is at a much affordable cost, and I think having the expertise and the modern technology is one step ahead in conquering cancer in our country.
A couple of decades in India, when we didn't have any technology at all, a lot of times we accept it. But when we bring the technology, the people wonder, it is okay when the technology is not there, because we are not able to provide that kind of high-end treatment. But when we bring the technology, the first thing which comes to mind is what is the cost? What is the cost? So the most important thing, what I was trying to make a point is, actually long-term technology actually reduces the cost to the patient. As I said, you heard me, that, is in a lifetime of a patient, when you look at various studies have been done, right treatment the first time to the patient gives a better outcome, less side effects. So imagine we treat cancer patients, this is my 40th year of treating. The difference between doing right treatment and subsidized therapy, or recently you even saw articles coming out, Lancet has produced an article where poorer section of the people, because they are not rated because subsidy and others, actually their mortality and side effects are higher. So we are in an era where we understand so much about cancer care. The cost versus benefit, when you look at it, first time right treatment produces better results, better outcome, and life cycle of the patient actually more cost saving. So I have made an argument that poorest of the poor should be really treated the right way the first time. So that is why technology is very important, to make sure we don't compromise just because somebody is poor. That kind of uniformity, that is a challenge. When you look at the challenge, when you look at today's subsidized therapy schemes and all, where they pay less, how are we able to deliver this high-end therapy to them? That is the point I was trying to make. The important thing is models have to be created where we don't refuse treatment to anyone. So even the poor, irrespective of the cost, have to be treated the right way. That is the most important technology. And while cost is an important thing, what is more important is patient safety and outcome. That is more important.
Tomotherapy that has been brought here together alongside with a Cyberknife that is already here for many years allows patients from all over India to come here and get the top-notch treatment as they would get anywhere else in the world. We used to have people coming to the UK, to France, to Germany, or to the US, from India, from Asia Pacific. That's not necessary anymore. We have got here the right set of skills with the doctors, with the physicists, with the technicians, and they have acquired the top-notch technology. You cannot find better anywhere else in the world. There is no need to move. Actually, the world should come here to get treated.
How is it going to heal the people?
Yeah. So the cancer used to be a bad disease. You used to die from cancer. This is a thing of a past. You would not suffer, you would not die from cancer in most of the cases if you get treated early with the right treatment. The tomotherapy allows you to be treated. A cancer is a disease that is recurrent, so it becomes a chronic disease rather than a lethal disease. And that's what is making the tomotherapy and the Cyberknife therapies very unique, because you allow the doctors to treat you in a way that you won't die from your cancer.
Tell me about the HCG.
HCG, I met Dr. Kumar a few years ago and I was impressed by his vision to make a viable, top-notch treatment to the most important populations. And he has been able to manage to get those machines that are very high-end to be able to use them here in India and to treat many, many patients. HCG is a group that that is standing out because they have a long-term vision. They are doing, it's a commercial group, but at the same time they do high academic work. And that's why we have been very attracted, because they have the vision, they have the quality doctors. As you heard, they have now doctors that Dr. Ajaikumar worked at MD Anderson. We have other doctors who worked in the UK. So we have got at HCG the right amount of skills and people that can use our machine the best they can.
Lastly, tell me about why to choose tomotherapy.
You know, there are very good products out there. There are very good machines, but tomotherapy is like a concentration of what you can find best everywhere, right? It's a ring entry, and it treats extremely precisely tumors, and that's why tomotherapy makes it such a unique technology.
Tomotherapy H is the most advanced unit today. The first time in India this kind of H unit we have brought. It's from Accuray. The main reason we have brought is we are looking at HCG group in quality of care, patient safety and outcome. The most important thing for cancer patient is how do we make this cancer a chronic disease. So we use various forms, radiation, medical oncology, surgery, but tomotherapy is part of radiation where there is precision. The precision is so advanced, I can treat multiple areas at one time without affecting the normal tissue. So things which thought previously we could not treat, today we are able to treat with this kind of therapy. The most important thing is, like for example, if somebody has a lot of disease in around the abdominal area, where in the past we used to think it affects the bowel and also we can't treat. So we can precisely treat only the tumor affected area and not treat the deeper tissues of the bowel. Similarly, treating the whole body without causing any side effects for certain patients, including bone marrow transplant. Certain areas of entire brain and spine for children, we need to do radiation. We can do without affecting them in any way, no side effects. So the most important here, this is a great arm for us to treat certain types of cancer patients very precisely and get better outcomes and have no side effects, including both short-term and long-term. So that is why we have been very privileged. We are very proud that we brought this kind of technology. Not only that, we are collaborating with the manufacturer to develop future education, training, skill training, software over a period of time. So it actually makes India very proud that we will be making future products hopefully in India itself. Okay.
People would go under depression thinking they are suffering from cancer, and once it has been treated, it would come back again. So how's the procedure going?
The idea is that is why right treatment the first time actually gives you less chance of this disease coming back. So we need to make sure with available technology, knowledge we have, each patient, irrespective of their socio-economic class, we treat them properly the first time, right time. That will give you better outcome, and actually in the life cycle they will be spending less if the disease doesn't come back. So important multidisciplinary clinic, put our thoughts, knowledge, and make sure each patient is individualized, what we call today's personalized medicine. That is the best way to treat, get the best results.